Hello guys, welcome back. In today's video, I'll be answering a very popular question most women has been asking. The question goes this way: can I be ovulating and still not get pregnant? In this video, I'll answer that question, but you need to stay tuned. If this is your first time of visiting this page, click on the plus sign to follow. Like this video, share this video to your family and friends, and save for later. Let's dive into it. Yes, it is possible to ovulate but not get pregnant due to for some various factors. Ovulation is the release of an egg from the ovary, which typically happens once in a month. However, there are various reasons that can prevent pregnancy even if ovulation occurs. There are several factors that can help one to get pregnant, not just ovulation. The first one is timing. Ovulation doesn't guarantee pregnancy unless it aligns with your fertile window, which is the few days leading up to and including the ovulation. So sperm can survive in the female reproductive tract for several days. So timing of intercourse close to the ovulation increases your chances of getting pregnant. So all these things are the things you should put in place in order to achieve pregnancy. Without proper timing, even if you ovulate, you can't get pregnant. The second one is sperm quality and quantity. Even if the ovulation occurs, if there are insufficient healthy sperm present, or if they have difficulty reaching the egg, which is the motility, it can hinder fertilization to occur, that is pregnancy from occurring. So any deviation from normal in the health of the sperm can cause you not to get pregnant. The third one is blocked fallopian tubes. Issues such as scar tissue, infection, or endometriosis can obstruct the fallopian tubes, preventing the eggs from being fertilized by the sperm. So any abnormality in the fallopian tubes can make the fertilization not to occur. That is, you can't get pregnant if you have any issues with the fallopian tubes, because after the ovary is the fallopian tubes that fertilization occurs. The fourth one is hormonal imbalances. Any irregularity in the hormone levels can affect ovulation or the ability of the fertilized egg to implant into your uterus. So the hormone that normally prevents an implantation when it is obstructed is progesterone. So if your progesterone is low, the eggs cannot implant. Even if it implants, you can have miscarriage area. So the next one is age. Fertility declines with age, particularly after the age of 35, making it more challenging to conceive even if the ovulation occurs. So older women above 35 have difficulty in conceiving even if they ovulate because of some various factors in their body. Then the sixth one is lifestyle factors. Factors such as smoking, excessive alcohol consumption, stress, and obesity can affect fertility and reduce your chances of conception. For example, stress. If you stress yourself a lot and you don't sleep enough, it can change some chemical balances in your body, which can obstruct your chances of getting pregnant. Health conditions. Certain medical conditions such as PCOS or thyroid disorders can disrupt your ovulation and decrease your fertility. So if you have any of these conditions such as PCOS, any thyroid disorders and the rest, it can decline your chances of getting pregnant. The next one is previous reproductive issues. So if you have had past surgery, maybe in the fallopian tube, infection or reproductive complication, that is PI, for example, PID, you have had pelvic inflammatory disease. This may impact your fertility and reduce your likelihood of conception. So I advise you, if you have any infection, maybe like PID, treat it with immediate effect to avoid these complications later in life. So it's essential to consult with your doctor or a healthcare provider if you are having any difficulty in conceiving. So they can help you identify any underlying issues and provide you the guidance on improving your fertility or exploring fertility treatment if necessary. So it's important to work with your doctor while on an fertility journey. So working with your doctor can help you minimize the time wasted and the years of waiting. Thank you.